Emergency vehicle operations and fleet maintenance are the topics we will be covering in Chapter 6. Once completed with this module, you should be able to identify and assess safety needs for both emergency and non-emergency situations, identify and analyze the major causes involved in line-of-duty deaths related to vehicle operations, discuss the process of selecting and training an emergency vehicle driver, describe the proper format for conducting a vehicle inspection check, and discuss the importance of vehicle maintenance as it pertains to safety. As you progress through this chapter, think about this scenario. Your organization needs additional drivers and will be posting a notice seeking qualified candidates. Your training officer approaches you for feedback on what safety factors should be taken into consideration on the posting. This is something new for your agency, as it never had a formal process for qualifying ambulance drivers before. Previously, the only requirements were that the candidate have a valid driver's license and drive around town with a training captain to ensure the candidate demonstrated good driving habits. Given an increase in motor vehicle collisions within the organization, however, the chief now wants a formal program implemented. In light of this need, what qualifications do you believe an ambulance driver should possess? What type of training should the driver receive to ensure he or she is a safe operator? Should the safety officer be on the committee responsible for validating ambulance drivers? What other issues should be considered? As a quick overview, this chapter will cover the selection of emergency vehicle drivers, including the training essential to prepare them and to maintain their driving proficiency, and it will conclude with a look at the importance of vehicle maintenance. If you recall from previous chapters, the first step in addressing a problem is to recognize it in the first place. As far as ambulance operations are concerned, there is ample data available to demonstrate the need for improvement. In 2014, NHTSA published a study that documented approximately 4,500 motor vehicle crashes involving an ambulance for the 10-year period from 1992 through 2011. Approximately 1 in 3 crashes resulted in at least one injury, if not more. Less than 1% resulted in a fatality. While that 1% does not sound too bad, it still accounts for 33 people who were killed due to a collision with an ambulance. As far as the injuries are concerned, those 4,500 collisions resulted in approximately 2,600 injured people. In both instances, injuries and fatalities, the majority of those negatively impacted were the public that EMS agencies and providers are employed to serve. Additionally, crashes resulting in injuries or fatalities were more likely while the ambulance was driving on an emergency basis. The textbook references other studies that have been performed on ambulance crash data and identified 4 primary human factors that contributed to ambulance vehicle crashes: knowledge, skills, ability, and attitude. Drivers must have knowledge of traffic laws that govern vehicle operation. With such knowledge, the driver may lack awareness of potential dangers. Inadequate skills in handling vehicles is a problem that can be addressed through training and experience. Some drivers simply lack adequate ability and exhibit poor judgment or slow or improper reactions. Driver attitude is also very important, as improperly using roads, allowing excitement to fuel impulsive actions, taking dangerous shortcuts, driving irresponsibly or recklessly, or failing to obey laws or take proper precautions can all result in unfortunate emergency vehicle crashes with potential injuries or fatalities. In emergency vehicle driving, there are 3 principles of safe operation: driver selection, driver training, and driver proficiency. These will be discussed momentarily in turn. Checking drivers' records can be helpful in identifying safe operators, as 41% of ambulance drivers involved in a collision already had previous citations for violating the rules of the road. As stated in the textbook, the 3 most important aspects of emergency driving are personnel, personnel, and personnel. Selecting and keeping qualified drivers behind the wheel is essential to the safe and efficient operation of an emergency vehicle fleet. When selecting drivers, 4 major considerations to be addressed are human aspects, acquired abilities, vehicle characteristics, and personnel records. As far as the human aspects are concerned, it is important to recognize that while human attitudes and activity can be altered through appropriate training, human nature is impossible to change. It is therefore important to conduct some background investigation work on potential emergency vehicle driver candidates. These evaluations should be performed occasionally as well, not just once someone is hired to never be reviewed again. The first step is to evaluate the individual's driving record for moving violations within the past 3 years, DUI convictions, reckless driving citations, and license suspensions. These are all risk factors associated with a higher potential for a vehicle collision at some point. Believe it or not, being in good health is also important for being a safe and effective emergency vehicle operator. This includes ensuring the driver has sufficient rest and nutrition, maintains an acceptable level of physical fitness, and is free from alcohol and controlled substances. A medical examination should be performed to identify cardiovascular disease, neurological and neurovascular disorders, insulin-dependent diabetes, and rheumatic, arthritic, orthopedic, muscular, neuromuscular, or vascular diseases that could interfere with the ability to control and operate an emergency vehicle. Commercial drivers are required to obtain a thorough medical screening for such items, yet it is rare to find ambulance services who require the same level of screening for emergency vehicle operators. Physical fitness was mentioned as well, which relates to routine tasks while driving, such as the ability to look over a shoulder to verify the area is clear before changing lanes or turning. How quickly can the driver move his or her foot from the gas pedal to the brake? Is the driver obese to the point where it interferes with his or her ability to actually turn the steering wheel? Motor skills are important, as is the need to be mentally acute enough to make split-second decisions to avoid potential hazards. And age can play a factor where a young candidate lacks any significant driving experience and an elderly candidate no longer has acceptable visual acuity. With this all being said, each person is different, and some of these physical requirements may have ADA implications as well. Working with a qualified physician as well as legal counsel is important when establishing physical ability requirements for emergency vehicle drivers. Judgment is also important, although it can be difficult to measure and quantify. With that being said, judgment is commonly evaluated in two aspects: excitability and maturity. The qualified emergency vehicle operator must maintain control of his or her emotions during critical or stressful situations. Having an overly excited ambulance driver is typically not a good thing. The maturity to keep emotions in check is also important when driving an emergency vehicle. Road rage is not acceptable, and the operator must always drive safely and with due regard, regardless of the nature of the call or the patient's condition. An individual's personnel file may provide some clues as to his or her demeanor and judgment that may play a factor into whether or not he or she should drive an emergency vehicle for your agency. An emergency vehicle operator must have knowledge about the operation of the vehicle and the environment in which he or she is driving. Driving on an emergency basis to the hospital with a critical patient in the back is a bad time for the driver to try and figure out how to change the channel on the radio to contact dispatch. The individual's attitude or disposition toward driving and maintenance is also very important. Immaturity, brazenness, being too laid back, or being the routine median are attitudes that do not necessarily translate into a stellar ambulance driver. Lastly, personal appearance and hygiene are also important and reflect on the individual's level of professionalism. The professional who takes pride in his or her appearance is more likely to exercise that same regard for the ambulance, the crew, and any patients he or she is transporting. As far as the selection process is concerned, the organization's safety officer plays a very important role in determining who is or is not qualified to drive the ambulance or other emergency vehicles. Not everyone can or should be an emergency vehicle driver. The selection process for an emergency vehicle driver candidate is a critical part of the emergency vehicle driver training program. Once individuals are selected, however, driver training is essential to maintain proper and effective driving skills and attitudes. Desirable driving habits need to be reinforced, while bad habits must be corrected and eliminated through training. While new drivers lack experience, it is impossible for them to gain that experience if they are not allowed to drive. While it is somewhat of a catch-22, EMS agencies need to rely on the non-emergency vehicle driving experience of new ambulance drivers while providing training to develop instinctive reactions that may not exist for someone used to driving a personal vehicle and not a big, heavy, and expensive ambulance on an emergency basis. Vehicle training courses help to instill vehicle handling skills in both new and experienced drivers and should be utilized routinely or often to reinforce these skills. Defensive driving is routinely taught to new drivers who, over a period of time, develop bad habits that increase the risk of a vehicle collision. Routine, comfort, and overconfidence in one's driving abilities often lead to problems down the road. Such problems or risks are magnified when driving an emergency vehicle. Any driver training program must instill defensive driving techniques in its operators, even if driving on an emergency basis. Drivers should not tailgate, even if the driver in front of the ambulance fails to yield. Drivers should leave a cushion between the ambulance and the vehicle ahead. When approaching a controlled intersection, slow down and account for all cross traffic. If at an intersection with a stop sign or red light, be sure to stop and ensure other traffic yields to you as an emergency vehicle with lights and siren. Defensive driving is an acquired ability that must be learned over time and consistently reinforced. Space management, following distance, rate of closure, hazard identification, correct braking techniques, and evasive maneuvers should all be taught as part of a proactive defensive driving training program. Candidates for vehicle driving positions should pass a written driving test as well as a practical road test. On-the-job training should also be provided to evaluate the new driver's performance under actual driving conditions. Maintaining adequate qualifications is also a must for anyone who drives an emergency vehicle. This means maintaining a valid driver's license, maintaining physical and mental fitness, participating in available driver training, and reporting any moving violations received while operating a personal vehicle, whether at work or not. The EMS agency is encouraged to run driver's license abstracts on all emergency vehicle drivers on an annual basis. While commercial driver's licenses are not required in Wisconsin for ambulance drivers, the training associated with a CDL course could prove useful to an ambulance driver. Ongoing training is also critical to ensure safe and proper ambulance operation. As part of formal driver training, it is important to cover the characteristics of an ambulance. Unlike a typical passenger vehicle, an ambulance is larger, heavier, and more complicated. Braking distances are longer, there are more blind spots, which requires greater dependency on mirrors, and drivers must also consistently remember that the patient in the back can typically feel every bump and turn. There are also different types of ambulances and emergency vehicles, which can impact handling and other physical characteristics that make a difference when driving. Anti-lock braking systems, airbags, and other newer features can also impact a driver's level of comfort when transitioning to driving a different vehicle. Many emergency service agencies also have specialized vehicles besides ambulance that require specialized training before operation. Given the increased liability that exists for services as related to driving emergency vehicles, record keeping is very important. In the event of an accident or other incident, attorneys and regulatory bodies will routinely ask to see training records of the driver to ensure he or she received adequate training and was indeed deemed qualified to drive the vehicle. These training records should include the classes the driver attended, any certifications or licenses obtained, along with the results of any formal proficiency assessments related to driving emergency vehicles. Routine checks of individuals' driving records through the state should also be performed and maintained. Too many moving violations or any DWIs would be considered indicative of someone who lacks the professional mindset necessary to drive an emergency vehicle. Such a record may also have an impact on insurance rates paid by the service for vehicle collision coverage. Drivers should also receive training on the formalities of the service's drug and alcohol policy. Even prescribed and over-the-counter medications can be a problem if they impede someone's reflexes or good judgment. Medications that make someone drowsy, for instance, should not be taken in advance of driving an ambulance. Other legal substances, such as alcohol and marijuana in some states, cannot be in an individual's system while driving an emergency vehicle. While the legal limit for blood alcohol concentration in a typical driver is commonly 0.08, many states require those driving under a CDL or an emergency vehicle to have what is known as complete or absolute sobriety, which is a BAC of 0.0. Many services prohibit the use of alcohol 12 to 24 hours prior to driving an ambulance or other emergency vehicle. There are numerous ways to train drivers, and there are numerous driver training courses available from third parties and educational institutions such as the FIS and local technical colleges within Wisconsin. Keep in mind that attending one training does not make someone an expert driver, and that continuous education and training is required to maintain safe emergency vehicle operations. Emergency service providers are encouraged to recertify or requalify its drivers on a somewhat regular basis, typically every 12 to 18 months. As part of a routine driver recertification, services are encouraged to consider an individual's actual driving experiences, observe proficiency and supervisory reports given performance in the field, the length of time since the driver's last recertification, and the need to introduce any new vehicles, equipment, or technology that is or will be used by the service. When evaluating driver proficiency, a service must also consider the impacts of shift work on its providers and drivers. Provider and driver fatigue is a very real problem in EMS, especially in services with 24-hour shifts. So long as employees have a period of uninterrupted sleep, the impact of shift work is not as detrimental as opposed to routine practices where EMS providers must respond at a moment's notice, regardless of whether they are awake, eating, training, relaxing, or sleeping. From a safety and health standpoint, the military has linked service suicides to sleep deprivation and, given the high incidence of suicides, divorces, alcoholism, drug abuse, post-traumatic stress, and other psychological ailments that seem to plague EMS providers, there may be an arguable link between these unfortunate occurrences and the lack of adequate sleep. Additionally, research has shown that sleep deprivation leads to impaired judgment and reflexes. For individuals behind the wheel of a vehicle, sleep deprivation can impair the driver to a level typically associated with intoxication in excess of the legal blood alcohol concentration limit of 0.08. Many professions, such as truck driving and airline pilots, have mandatory sleep or downtime to combat the effects of sleep deprivation and fatigue. Medical schools are also starting to restrict the amount of hours worked by residents due to the negative resulting impact on patient care due to medical provider fatigue. While many in EMS enjoy the perks associated with shift work, there is a growing body of research and data that shows how such shift work is detrimental to emergency workers and the patients they serve. Another reality of EMS work is the likelihood of being interrupted while eating. As a result, many EMS providers have diets that are less than optimally nutritious. Chronic reliance on fast food, eating in the ambulance, maybe even when driving, eating quickly, consumption of caffeine and sugar-laden sodas, energy drinks, and other similar beverages, and an overall lack of fitness and routine exercise can also take a toll on a provider's overall health and well-being. Over time, these habits can be a problem as emergency vehicle drivers and EMS providers in general are expected to be mentally and physically fit for every response. A driver's physical fitness may be affected by his or her health as impacted by a lack of quality sleep, routine fitness, and a healthy diet. This can ultimately have an impact on the driver's overall performance as an emergency vehicle operator. Drivers must operate emergency vehicles in all kinds of weather, and poor road conditions demand considerable consideration and focus. Poor health and fatigue are factors that can have a significant negative impact on an emergency vehicle operator's ability to function safely. In addition to the training related to the driving and operation of an ambulance, proper cleaning and disinfecting techniques should also be taught and reinforced, as the driver is a member of the EMS crew responsible for ensuring the ambulance is cleaned, stocked, and ready to transport patients. Each year, a percentage of EMS injuries and deaths result from mechanical problems and vehicle failures. While some larger EMS providers may have mechanics or someone specifically responsible for vehicle maintenance, all emergency vehicle operators have a duty to ensure their vehicle and its equipment are in good repair and ready to respond at all times. For the ambulance service, this means performing routine periodic maintenance on all vehicles within its fleet. For the ambulance driver, this means conducting routine checks at the start of every shift. Daily checks should include checking the tires for wear and proper air pressure. Check fluid levels. Ensure all vehicle lighting works appropriately, from headlights, brake lights, and backup lights to all emergency lights. Ensure the horn works along with the siren. Verify the proper functioning of accessory equipment as well, such as radios, cellular telephones, GPS devices, and medical equipment within the ambulance. Any medical gases stored on the ambulance and compressed gas cylinders should be within acceptable ranges, and low cylinders should be topped off or replaced. The providers themselves should also check the ambulance at the start of each shift to ensure all batteries are charged, equipment is stocked, and surfaces are clean. Documentation should be maintained of all checks and maintenance, including the daily vehicle check. If it is determined through the daily check that the vehicle is unsafe or is not in a condition to transport patients, the vehicle should be taken out of service. Again, given the increasing complexity of emergency vehicles, along with the importance of everything working correctly, the use of emergency vehicle technicians is becoming more prevalent in EMS, especially within larger services with multiple vehicles. Ambulance service providers without such technicians, however, must still ensure that adequate routine maintenance and prevention is performed. Tires are an often overlooked component of an emergency vehicle, yet they are critical to the proper maintenance and functioning of any emergency vehicle. Daily inspections of tires should begin by evaluating the tread wear on the tires. Ensure the tires have adequate treads and are not bald or worn down, as this can have a significant impact on the vehicle's handling ability, especially on wet or snow-covered roads. The treads can also provide a glimpse into other issues if the treads appear to be wearing unevenly. Tires are commonly rated for traction as well, with some tires being better than others. While there is not much a driver can do about tire temperature, it is important to understand that temperature can impact the performance of a tire by affecting the air pressure within the tire. As air cools, it shrinks. Inversely, warm air expands. The same happens with the air within the tire, which is why some mechanics recommend using nitrogen instead of air to inflate tires. Nitrogen does not expand or contract as much as ambient air when exposed to extremes in temperatures. If the ambulance is functioning in a cold environment, it is important to ensure the tires are inflated properly to accommodate the ambient temperature at which they will be functioning. Underinflated tires result in stress on the sidewall of the tire and can be a precursor to a blowout. Tires themselves are also rated based upon their ability to dissipate heat generated while driving. Some tires are better at this than others. Proper inflation information can be found in different areas. Some ambulances have the tire inflation requirements on a label within the door frame. Some may document inflation requirements within an operator's manual. Tires themselves are often stamped with information that indicates proper inflation pressure as well, although the information on the tire is designed to reflect the tire's maximum inflation pressure, not the recommended inflation pressure for the respective vehicle. If there are any inconsistencies between these different information sources, the ambulance manufacturer information should be followed. There can be significant differences between tires that may look similar. Tires come in different sizes, different construction, and different load-bearing capabilities. Tire information is included on the sidewall of a tire. Ambulance manufacturer recommendations should be followed to determine proper tires for the ambulance. While there are commercial gauges available to measure tread wear, many use a penny as a quick cheat to check that there is at least 1/16 inch of tread available on the tire by inserting a penny in the tread and checking to see if there is at least enough tire to reach the top of Lincoln's head. As already noted, routine, systematic inspections of emergency vehicles are very important to ensure safety and proper functioning. It is recommended that EMS agencies develop standardized routines and inspection schedules for all fleet vehicles. When inspections are performed, they should follow a standardized methodology so that nothing is inadvertently missed. All inspections and maintenance activities should also be documented. Ultimately, if the ambulance is ever involved in a motor vehicle accident, those maintenance records may prove very important in a subsequent accident investigation. If a lawsuit results, it is a safe bet that those maintenance and inspection records will be subpoenaed as well. Again, documentation of routine inspections and maintenance serves a couple purposes. While helping defend the ambulance company in the event of a lawsuit given the ambulance's involvement in a collision, the use of standardized documentation also helps ensure consistent and thorough inspections by ambulance personnel and drivers. Every emergency vehicle should have a defined inspection schedule in place. Within the schedule should be both quick inspections, which are performed on a more frequent basis, along with full inspections, which typically require specialized equipment to perform. The textbook provides a list of items that are commonly included in quick inspections, such as vehicle lighting, functioning of gauges, checking fluids, verifying tire pressure, and other elements critical to routine vehicle operation and functioning. While there is a separate legal course within WCTC's EMS Leadership and Management Program, and this course will not delve deeply into the legal impacts of vehicle inspection and maintenance, it is still important to recognize that the legal expectation of a reasonable emergency vehicle operator is that he or she performs routine inspections to ensure the proper functioning of an emergency vehicle. Failure to perform routine inspections in compliance with service guidelines can ultimately give rise to legal liability for negligence. Following an inspection schedule is very important. Many ambulance manufacturers provide guidelines on what should be inspected at what frequency. Comprehensive maintenance programs recognize the value of preventative maintenance and ensure such maintenance is being performed. A little prevention can go a long way, and maintaining an ambulance in working order is not only important for service operations, but it is cost-effective in the long run. Ultimately, if vehicles are not ready for responding to a call for service, or if they break down during a run, the organization cannot mitigate emergencies effectively. Ambulance drivers are the daily first line of defense in proper vehicle inspection and maintenance. Each service should have a process in place to document vehicle concerns, issues, maintenance needs, and work orders or requests. As already mentioned, vehicle maintenance logs should be maintained. Each service has its own policies and procedures regarding driver responsibility for vehicle maintenance and repairs. Larger services may employ emergency vehicle technicians, while smaller services must rely on individual drivers, officers, or individual crew members. Necessary repairs, once identified, should be made on vehicles as soon as possible. Delaying necessary repairs can actually lead to more significant problems down the road. If a vehicle experiences a problem or malfunction during a run, the driver and crew may need to contact the service for another ambulance or even call another service and transfer patient care if the nature of the malfunction requires the ambulance to be removed from service immediately. Ultimately, what needs to occur will depend on the nature and severity of the malfunction. There may even be an opportunity to make a repair during a run, depending on the nature of the malfunction and the scenario. At all times, however, patient care must be a priority for the ambulance driver and crew. It may be possible to complete the call, including transport of the patient, if the malfunction is minor. Even such minor issues must be addressed as soon as possible, however, lest they become larger problems. In reviewing the scenario provided at the start of this module, it should now be clear that emergency vehicle drivers must possess specific qualifications before being allowed to drive one of your service's vehicles. Your service should also have a formal comprehensive driving program in place to provide ongoing training and skills development to your emergency vehicle operators. There are obviously many facets to consider when creating or evaluating a formal driver training program, and your agency's safety officer may provide a unique perspective on any developed program. With this module completed, you should now be able to describe some of the causes of ambulance crashes and the injuries and deaths that result from crashes. Describe the 3 principles of safe emergency vehicle operations. Describe the 4 major considerations of a driver selection program. List the concepts of a comprehensive defensive driving course that introduces and reinforces driving skills. Outline the minimum education and training qualifications for emergency vehicle drivers. List the specific areas that need to be checked during a quick check inspection. And explain why record keeping and vehicle maintenance plays a significant role in ambulance crash investigations.